We've filmed many water videos and I've mentioned the measure of it, but the comments I receive, sir, make it difficult for me to calculate how much water I drink in a day. Not everyone can carry a 1.5L plastic bottle, drink water from it, and finish it during the day. Cups can become mixed up and get mixed up during the day due to the zero amount of tea and coffee that we consume. How do we know if we have enough water? At the end of this video, you'll understand if you've had enough water or not. When you don't drink enough water, our body has receptors. When dehydration occurs, these receptors are stimulated, and the first thing that emerges is thirst. Yes, you heard it wrong. In fact, when there is a fluid deficiency between 250 and 500 milliliters in our body, thirst occurs directly. But we can't rely on luck. Why? When a person is thirsty during the day, the feeling of thirst falsely disappears when they take a sip from the tea next to them. Mouth dryness improving. However, body's water shortage doesn't completely disappear. Usually people can't act according to their thirst. Actually, if we drink a glass of water when we are thirsty, most of the problems will be solved. But since we are constantly in a state of drinking something during the day, thirst is usually not a good indicator for us. The next symptom that appears in the next period in Sesame is an increase in heart rate. If your heart rate is around 60-65 during the day, if you feel that your heart rate increases at that moment, or if you receive a higher alert about your heart rate from your smartwatch, or if you feel that it increases more than normal when you count your heart rate, or if you feel palpitations, it is likely that you haven't consumed water. The first thing that happens after running is an increase in heart rate. When heart rate increases, you may perceive it as palpitations. I can even inform you about this. The most common cause of palpitations in metropolitan disease is dehydration. Drinking less water causes an increase in heart rate and thickening of the blood. Due to decreased oxygen transmission ability, the heart works more rapidly in an attempt to deliver oxygen to the tissues. If your heart rate has gone up, it indicates that it is time to consume water. The third symptom is a headache. Not everyone may feel this, but when the loss exceeds more than 1% of the total water in the body, migraine-like headache diseases can occur. If your head begins to hurt, it indicates that it is the appropriate moment to consume water. Dizziness is the symptom that arises when we lose 2/3 of the overall water in our body. Your blood pressure is beginning to decrease gradually. If you experience your eyes becoming darker and your head spinning when you stand up, it is likely that you are dehydrated. If you adore the antithesis of this, it signifies the presence of a profound longing. You will utter, sir. The person will faint and be unaware of their thirst. Yes, we frequently observe this. The primary cause of most patients seeking medical help for fainting is low blood pressure and dehydration. People can faint after a while because they usually do not take their symptoms of thirst seriously, do not take their palpitations seriously, and do not take their headaches seriously. We work intensively, we work while looking at the screen, we know how to notice changes in our body. An intense fluid loss can catch us in the form of fainting. If you faint, be sure to pay attention to your water consumption. You can also gauge your thirst by observing the color of your urine. Darkening urine color indicates dehydration. If your urine color is close to water, it is likely that your water consumption is high. Pay attention to the symptoms and test your thirst. These are crucial. If you pay attention to them and accurately interpret the signals your body sends, you'll be disease-free due to dehydration. Don't forget to subscribe and enable notifications. Goodbye.